Dementia is a complex and often misunderstood condition that affects millions of people around the world. At its core, dementia is not a single disease, but rather a term used to describe a group of symptoms affecting memory, thinking, and social abilities severely enough to interfere with daily life. While memory loss is a common feature, dementia also involves changes in communication, reasoning, judgment, and behavior. But what causes dementia, and why does it develop in some people and not others? The most common cause of dementia is Alzheimer's disease, responsible for 60 to 80% of cases. In Alzheimer's, abnormal protein deposits in the brain, such as amyloid plaques and tau tangles, disrupt the normal functioning of brain cells. Over time, these cells lose their ability to communicate and eventually die. This gradual death of brain cells leads to the hallmark symptoms of memory loss, confusion, and difficulty with familiar tasks. But Alzheimer's is only one of several types of dementia. Vascular dementia, the second most common type, results from reduced blood flow to the brain, often due to strokes or conditions that damage blood vessels. When brain cells are deprived of oxygen and nutrients, they become damaged or die, leading to problems with thinking, planning, and reasoning. Mixed dementia, where both Alzheimer's and vascular changes are present, is also common, especially in older adults. Other causes of dementia include Lewy body dementia, characterized by abnormal clumps of protein called Lewy bodies in the brain. This form shares some symptoms with Parkinson's disease, such as movement troubles, as well as cognitive changes. Frontotemporal dementia, on the other hand, involves degeneration of nerve cells in the frontal and temporal lobes of the brain, affecting personality, behavior, and language more than memory. There are also risk factors that make some people more likely to develop dementia. Age is by far the greatest risk factor. The chances of developing dementia increase significantly as we grow older, particularly after age 65. Genetics also play a role. Certain genes can increase susceptibility, especially in early onset forms of dementia. However, having a family member with dementia does not guarantee that someone will develop the condition themselves. Lifestyle and health factors contribute as well. Conditions that damage blood vessels, such as high blood pressure, diabetes, high cholesterol, and smoking, also raise the risk by affecting the brain's supply of oxygen and nutrients. Physical inactivity, poor diet, and lack of mental or social engagement may further elevate the risk. Sometimes dementia-like symptoms can be caused by treatable conditions. Depression, vitamin deficiencies, thyroid problems, infections, or reactions to medications can all mimic dementia. That's why a thorough medical evaluation is critical if someone begins to show signs of cognitive decline. It's important to understand that dementia is not a normal part of aging, though age increases the risk. The underlying causes involve damage to brain cells and the connections between them, which disrupts the normal communication pathways necessary for memory, reasoning, and judgment. Over time, as more brain cells are lost, symptoms worsen, and daily life becomes increasingly challenging. While there is currently no cure, for most types of dementia, research is ongoing. Scientists are investigating the exact mechanisms that lead to the buildup of abnormal proteins in the brain, the role of inflammation, and how lifestyle changes might help protect brain health. Early detection and intervention can help manage symptoms, improve quality of life, and allow patients and families to plan for the future. Understanding what causes dementia is the first step toward compassion, support, and ultimately, hope for better treatments and prevention in the years to come.